Guys, it's 2025 and we're still running and interpreting blood work as if we're stuck in the 70s. If you're somebody that feels sick or knows something might be wrong, but your labs look normal, you should listen to this video. My name is Dr. Nash. I'm a chiropractor and functional medicine practitioner here in Kansas City, and this is an issue that I run into almost every day in office. So typically one of two things are happening. Either a patient comes in to me, they bring in their annual lab work that they have ran by their PCP, or a patient went into their PCP with a complaint and they ordered some lab work to see what was wrong. Typically what that lab work looks like is a CBC, a complete metabolic panel, a lipid panel, maybe a urinalysis or a TSH. Those are all good biomarkers. However, we are missing so much information when that's all that we look at. So I have two main issues with just running that blood work. The first one is we're missing so many biomarkers that could give us really valuable information. So instead of running a full thyroid panel with antibodies, with free and total thyroid hormones, we're just looking at your TSH. We're not looking at nutrient markers. We're not looking at inflammation or insulin or what are your hormones doing. We're really limiting what we can look at and what we can find just looking at some of these basic panels. The other thing, and this is where some people show up normal, is the reference ranges that we use can sometimes be way too wide. So in functional medicine, what we do is we shorten up those reference ranges. So we try and find what's optimal for this biomarker, and then that's the reference range that we use. Classically, what happens is that when the labs make these reference ranges, they take the bell curve of everybody that's been tested, and then they splice off the 10% on the outsides. Well, everybody here that's kind of on the fringe, almost to that 10%, they're considered normal, even though they're well on their way to having some sort of dysfunction or ongoing disease process. That's one thing that I love about functional medicine, is that we're not sitting and waiting to make a diagnosis. We're aggressively pursuing prevention, early detection, optimization. How do we make it to where you are functioning at your absolute highest? One of the analogies that one of my instructors loves to make is that if I'm walking down the street, I drop my wallet. But instead of looking for my wallet where I dropped it, I'm going across the street and I'm looking under the light pole. Why would I do that? Oh, well, I can see here. Unfortunately, that's kind of what we're doing with some of this blood work. We're only looking at what we can understand or what we are trained in, but that's not always the best place to look. So what I love about functional medicine is that each case is different. So in order to find what blood work, what lab work should we be looking at, we're going to go into a full case history. We're going to sit down for a long time. We're going to talk through all of your different complaints. We're going to talk about everything leading up to this moment. And then once we have that information, we're able to make a pretty educated guess of, okay, where should we be looking? What do we need to be testing? Blood work is the tip of the iceberg. There's so many other things that we could be looking at, so much more information that we can get to give us insight on what's happening in your body and how we can improve that. And what's so awesome about that is that once we get all that information, now we can aggressively pursue wellness, optimization, prevention, early disease detection. That way we're not doing the sit and wait game. We're not in this limbo of, yeah, I know you feel like crap, but everything looks normal. No, we're just not digging deep enough. If your labs look normal and you feel like crap, you have the wrong labs. Nobody likes to be gaslit. So if this message is resonating with you or you know somebody that this sounds like, I encourage you to share this message, dig a little bit deeper, listen to your body. If you think something is going wrong, there very well might. So do yourself the due diligence. If you need more resources, you can always head to my website, ablefunctionalmedicine.com. You can also go to ifm.org where you can work to find another practitioner. I am also currently offering upgraded annual lab work. So what that's going to include are things like a CBC, a CMP, insulin, an advanced lipid profile, hormone panels, nutrient panels, thyroid and anemia panels. That's a great baseline. That's a great way to track progress over time, but also work towards some of those other things like prevention, optimization, and early disease protection.